Hi everyone, it's Joyce with Grow Your Green Family. Welcome to our interview with one of our local wellness experts. This is part of an effort to build sort of a library of really awesome information from local wellness experts that you can't often get your hands on. So this is a really awesome opportunity. We're here today with Dr. Van Zant from the Crossroads Wellness Center in Morton.
Thank you.
Thank you, Dr. Van Zant, for joining us.
Absolutely.
This woman right here is a very hot item in the area. She's difficult to get into. She's booked out for months in advance, and for very good reason. She has an excellent reputation for really helping people get to the core of their ongoing health issues. So we're very fortunate today to have a few minutes of her time to talk a little bit about gut health. Now, I know we did gut health last month in January, but we're going to jump back into that topic today because we really want to make sure that you're knowledgeable about what does the average person really need to know about gut health. So that's what we're going to talk about today. Before we dive into that, though, Dr. Van Zandt, I'd really like it if you could explain to us what is integrative medicine or functional medicine, because that's what you do. That's what your specialty is.
Integrative medicine is really kind of an all-encompassing term where it describes the mesh of traditional medicine or conventional medicine with other things that may benefit the patient that may not have the same kind of underlying research behind it, but yet may in theory make sense. It, always first do no harm to the patient. So integrating other types of things like nutritional approaches, supplements, anything that the practitioner feels comfortable with that's out of the mainstream into their practice. But integrative medicine really talks about combining the best of conventional or traditional medicine with those things out there that would not harm the patient but may add some benefit to their care. Now, functional medicine I see is almost like a subset of integrative medicine because there's many types of things that patients could call or providers could call integrative medicine. Somebody could do supplement therapy and be an integrative doctor. They could do acupuncture and be an integrative doctor.
Okay.
So it's really how the provider defines themselves to be an integrative doctor that encapsulates what that means, integrative medicine. Functional medicine really has its roots in, I like to think of it as conventional medicine with a bigger toolbox. That functional medicine is looking for root cause, trying to understand why you have depression, why you're truly anemic, why you're fatigued, why you keep getting infections over and over, as opposed to just giving you a medication for it or sending you for counseling or whatever the case may be. This is really trying to understand what's gone wrong within your system to address that, correct it, and hopefully totally take away the problem or at least improve the symptoms from the problem.
Okay, so I like to think of you guys as sort of the private investigators of the health world, right? So
yes, that's how I would describe functional medicine. Yes, I'm your personal detective.
I love that, right? So there's so many people, you guys, I'm out there in the community, I'm talking to lots and lots of people in the community, and I know many of you have been suffering for years with random weird symptoms, sometimes really serious, sometimes more annoying than anything else, and yet we're just living with them day in and day out. We go to our doctors, we tell them what's going on. Doesn't seem to be answers. They do a test, they run a lab, they do something, but they don't really know why. They don't seem to have an answer for what the next step is. So it seems like a good candidate to come and see an integrative medicine doctor or a particularly functional medicine doctor would be someone who's been dealing with the kind of ongoing health issues. They can't track down what's going on. They would come to see someone like you to help figure out what is going on behind the scenes.
Right. Looking at all the different aspects to hopefully find one or several root causes that could explain the variety of symptoms that a person is having.
And you guys tend to have a little bit bigger toolbox than traditional doctors do, it seems like, in terms of you bring in many different aspects of not only traditional medicine, but also holistic medicine, herbs, supplements, other things.
Yes. And I think the labs probably, the other labs that we offer are really the difference, in addition to some of those things like looking at natural products or more of a holistic approach, just, spiritual, mental, kind of the mind-body connection is important. But I think what functional medicine doctors do is we look at different labs. We try and get data that can really help support and find what's going on. So we do different testing that in some cases is covered by insurance, but a lot of the times is out of pocket, and so that can be limiting. But really, it's pushing the envelope of our conventional care to look at other things that could give us information and explain underlying cause.
That's awesome. They do have there's a group of doctors, and one of the things I love about being around you folks is that there's such a sense of collaboration. It seems like there's a group that gets together every other month, and they share case studies, and they talk about what testing they're getting done, what labs they're getting done, that sort of thing, and really comparing notes, which I just think is amazing. So I love it. Okay, so getting back to your average people, which is most of the people watching this video, most of you are kind of out there doing your thing. You're not super into the natural world, but maybe you're kind of testing it out. But or you're parents and you've got kids at home, and you might be curious, what are the signs and symptoms of gut health issues that average people, average families should be on the lookout for? Because they're not what you think they are a lot of times.
Well, I mean, some of them are obvious. Unexplained abdominal pain, constipation without an obvious cause, like something that's due to medication or poor diet. Those are obvious causes of constipation and can be readily potentially changed. But constipation where it's defined as what's called functional, that your doctor may say you have functional constipation, which means you have constipation, there's really no great underlying cause that we can find. Or loose stools. If you're eating the standard American diet, which is more processed foods, kind of anything that traditionally would be served anywhere, eating out quite often, especially with kids, we're running all over to activities and eating out at McDonald's or fast food chains kind of on the go. If that is a majority of the diet, that can contribute to gut health problems. But really, that standard American diet doesn't cause most people to have loose stools unless there's an underlying problem. So, if you're eating lots of fruits and veggies, multiple, 5 to 7 times a day, then you may have a bowel movement 1 to 3 times a day. But if you're eating that more standard processed diet and you're having multiple stools a day, 2 to 3 times a day, if they're loose, liquidy, if you're having urgency running to the bathroom every time you eat, or a lot of discomfort after you're eating with pain and gas, those are flags for an underlying dysfunction of the gut. Perhaps some things that may not be as well connected would be things like unexplained fatigue, especially after you eat. If you feel very tired after you eat, that could be a reason to suspect that there's a gut issue. Anemia without a cause, that is definitely something to look at. If there's no bleeding concerns for the person, then anemia without a cause, high suspicion for poor absorption in the intestinal system, and some type of gut issue. There's some skin issues that you can see, like little white marks on the fingers can be a sign of zinc or calcium deficiency, which can go back to poor diet or absorption issues. The little bumps that you get on the back of your upper arms or the back of your thighs, those can be a sign of nutritional deficiencies, which could point to gut issues.
Okay. And then also, I've been doing some reading, and I'm watching a lot, learning a lot, and there's other factors too, like people that are struggling with autoimmune disorders. Can that oftentimes be related to gut health issues?
Well, yes, and there's a specialist out there, a pediatric gastroenterologist, who is quite well published, and his belief is that potentially a majority of autoimmune issues start from gut dysfunction. That really goes back to the fact that the gut, or the intestinal system, is surrounded by the majority of our immune system. 70% of our immune system, our protective system in the body, lays right outside of our intestinal system. And that makes sense if you think about what's going on there. Like, it's basically a tube from the outside that we're putting food in, and it's running through our body. And when we put stuff in that, our body needs to be on right up there, with full line of protection to make sure that nothing bad from the outside world is coming into our body and causing problems. Chemicals, bad bacteria, bad parasites, anything that, foods. I mean, obviously we know when we have food poisoning that we react usually with some kind of gut issue, and that's because our body's trying to get that out before it poisons us.
Mm-hmm.
So our immune system's right there to protect us, and 70% of it is focused in that area.
Interesting. And even emotional issues are starting to link people struggling with depression, anxiety. I know I've been working through some of the GAPS book. There's a diet out there that's often suggested sometimes for people with gut health issues. It's called the GAPS diet, if you haven't heard of it. And I know that they suggest that there's linkages between gut health issues and even more severe emotional issues.
Well, absolutely, and we know that there is something called the gut-brain axis.
Mm-hmm.
A lot of a hormone called serotonin, which is the feel-good hormone in our body, is made in the intestinal lining. And so if there's problems in the gut, you could be lacking some of that hormone that you need to feel good, happy, balanced. If you're lacking it, it can lead to anxiety, depression, panic attacks. So there is a definite gut-brain connection.
Mm-hmm.
If you have food sensitivities or problems digesting and absorbing, or too much bacteria in your intestinal system, or too much of something called yeast in your bacterial or in your intestinal system, then that can also cause chemicals to be made or not made that's going to affect how you feel.
Mm-hmm.
So we definitely see food sensitivities and gut issues linked to mood.
Mm-hmm. Interesting. Yeah. And even people, we've got some gals in the community I've talked with. Jessica Ford, I interviewed her on Facebook Live last year. She was struggling with chronic back pain and was having some sort of subtle issues that she just sort of ignoring, some constipation, some difficulty swallowing, things that she just thought that was normal for her. But it turns out she had some gut health issues. And when she worked on those gut health issues, her chronic back pain, which she had even, she just figured she'd be living with that the rest of her life because her parents had bad backs too. Her back pain issues all went away. So she had spent thousands of dollars at the chiropractor with continuous effort, only to find out that that was not about her back. That was an inflammation issue that was associated with her gut health issues.
Yes.
So there's a lot of different factors here, guys, and it's kind of a matter of, if you've been struggling with an issue for a long time, that's not normal, really, is what
Correct.
we want to.
Yes, I think you hit the nail on the head. Too many people think, this is just me. This is how I am. Or my family has always struggled with whatever, constipation or irritable bowel syndrome. So I must have it too. Or my family's had this, or I'm going to pass this on to my child. And I mean, there absolutely can be genetic and family tendencies, but I think people let it define who they are and just assume that this is normal because they don't know any other normal. And I have had a decent number of adults come in and say, I've struggled with this since I was a child. I thought it was normal.
Yeah.
I only had a bowel movement once a week or every 2 weeks, and I thought it was normal. And so that's not normal. And some of this, I'm glad for what you're doing, because it just needs to be brought to light to say, not everybody is identical, but certainly a lot of people accept how they function as just who they are. And I think that's where people are getting all this chronic disease downstream.
And so that brings us to, obviously, folks, if you've been struggling with some ongoing issues, then you're going to, you want to start thinking about maybe exploring your options. Know that there are options. I think that's the biggest thing that's the biggest message I could offer to the community is so many of us live with these things. We've been to the doctors. There doesn't seem to be any answers. And then they just sort of live with it. But I need you to know that there are options out there. There are things you can track down. That's part of the resources that are available on Grow Your Green Family. We've got wonderful experts here, right here in Central Illinois. You don't have to travel to Chicago or New York. You can get some answers right here. So I think that's really important. But the other aspect of it is for those of you that really don't feel like you have any gut health issues, or maybe everything's okay right now, I think the last piece of the puzzle is what can we do to protect our guts over time? Because most people are not doing anything like that. Most of us don't even know what affects our gut health. So just quickly, I wrote an article about this last month. Some of the biggies, and you can let me know if I miss anything, but some of the biggies that can directly affect your gut health are the use of antibiotics. And I'm not saying don't take them. You just need to be aware that if you do take them, you need to support your gut because it's going to wipe out some of your good gut bacteria along with the bad ones. So antibiotics is one, steroids is another. Chemotherapy, if you're dealing with chemotherapy, you're going to want to support your gut health. Let's see, what's my fourth one? Birth control or hormone therapy. So women, ladies, if you're younger and on birth control, or if you're older in the older age groups and you're on that hormone replacement therapy, you need to know that those can negatively affect your gut health. And what else? We talked about fast food and a lot of
Yes,
processed
obviously
foods.
what you eat. Processed food, fast food, eating a diet that is as best as you can clean, what I call clean. So, proteins that don't have a lot of additives to them. Trying to get meat that is minimally processed. If you can afford organic, of course, that's always the best way to go. But if you can't afford organic, try and at least get your own meat, and don't buy prepackaged meats that have a lot of the added sauces or flavorings. Do it at home if you can. We know that it's not possible to do things 100% of the time perfectly, but
That's right.
70%, 80% of the time, if you can try and live a cleaner diet, eating more fresh fruit, more veggies, eat seasonally,
Yep.
buy local from the produce people. I mean, in almost every community now in central Illinois, you can go to a farmer's market and take advantage of that and buy, when you can, from spring through fall, those great veggies and fruits that are available, because they have had less processing than what's in your store.
Yep.
So take advantage of those options when you can and bring that in. Introduce new foods into your family's habits. Try new recipes and challenge yourself. You don't have to make something new every night. Try something new once a week or once a month. Just aim for change, aim for variety. uh, there are some data, that limiting grains could potentially be helpful, but that I don't want to make a blanket statement,
Yeah.
because everybody's different.
Yes.
And so, but processed food and eating out a lot can really wreak havoc. So trying to make good choices if you do have to eat out, and incorporate the salads. Some of these places now, veggies you can get. Trying to do your best with every meal to make the best choices. And if not, looking for snacks that are healthier instead of grabbing a Snickers bar. A handful of nuts and fruit. Sometimes planning ahead is going to save you a lot of time and headache. Just
Yes.
planning ahead for the week, put frozen meals in the freezer, making those little baggies filled with snacks ahead of time if you have an hour on the weekends. That can make a difference.
Awesome. So this is great information, guys. One of the things that I'm a huge advocate for at Grow Your Green Family is it's not about being perfect. It's just about getting started. I don't care where you start. I don't care if you're smoking and you're eating McDonald's 3 meals a day. There's always something you can do. So don't let being perfect hold you back from getting started.
Right.
And there's lots of resources, there's lots of support, and we're here for you. And we've got lots of more good information coming out for the rest of this year. So stick with us here at Grow Your Green Family. And Dr. Van Zandt, I just want to say thank you so much
yes,
for
you're
being a
welcome.
part of this. And hopefully we will be continuing to reach out to people. If you have a topic that you're particularly interested in, please let me know, and I will track down resources and experts and see what we can get to get some of this really great information out in the community. So stay tuned on our Grow Your Green Family YouTube channel and on the Facebook page, and we'll catch up with you soon. Thank you so much.
Great. Thank you.